The Subcommittee on Border Security Facilitation and Operations will come to order. Today, the subcommittee meets to examine the response to COVID-19 by 4 of the private contractors responsible for managing facilities in U.S. Immigration and Customs Enforcement's detention network. As coronavirus cases continue to spike nationwide, we must ensure that the contractors our government relies on are taking every step they can to minimize the spread of COVID-19 among workers and detainees. For fiscal year 2020, Congress appropriated approximately $3.1 billion for more than 45,000 single adult and family ICE detention beds and other custody operations. Over 80% of these beds are operated daily by private contractors, some of whom are at this hearing today. That is a large amount of taxpayer money, which is funding a historically high number of detention beds, and it demands oversight and accountability. Detention facilities must be held to a high standard at all times, but in this moment, it is of vital importance. And yet, over the past few months, it is clear that ICE and its contractors have not taken this outbreak seriously and have not treated it aggressively enough. More than 3,000 detainees, 280 contractors, and at least 45 ICE employees assigned to detention facilities have now tested positive for COVID-19. Sadly, we have lost at least 2 detainees, a potential third today in the state of Florida, and 5 contractors due to complications from the coronavirus after exposure at detention facilities. Despite these horrific losses, ICE is continuing normal operations and contractors are following in lockstep. ICE continues to transfer detainees between facilities and contractors continue to accept them. Further, there is overwhelming evidence that these transfers have likely contributed to multiple COVID-19 outbreaks inside of ICE detention facilities across the U.S. We've also read reports and heard from current and former employees that guidance issued by the 4 companies represented here today suggested rationing of personal protective equipment. While documents provided to the committee show that management at a few facilities are attempting to practice social distancing, the clearest way to prevent the spread of this disease in the facilities is to pursue alternatives to detention and release those detainees who pose no threat to communities. The high risk of exposure to COVID-19 at these facilities is further exacerbated by inadequate medical care. Prior to the pandemic, health services provided in detention facilities were severely lacking and proved to be the source of most complaints by detainees. So it is no surprise that the current public health crisis has only compounded that situation. Some facilities are reportedly waiting days or weeks to test individuals, including the most vulnerable detainees. The bottom line is that much more needs to be done to stop the spread of the coronavirus at these facilities. To protect the health of both detainees and the American people, guidance to facility personnel must be clear and explicit. Transfers between facilities must be stopped immediately, and adequate medical care must be provided. COVID-19 does not distinguish between U.S. citizens and non-citizens, and neither should we in our approach to protect against it. I look forward to hearing from our witnesses today about what additional steps they will take to address this pressing issue going forward. The chair now recognizes the ranking member of the subcommittee, the gentleman from Louisiana, Mr. Higgins, for an opening statement.
Thank you, Madam Chair. It's wonderful to join you in this meeting today, and it's a very important topic. And I thank the witnesses for being here today. I further sincerely appreciate Chairman Thompson opening the hearing room to members to conduct official business. As you know, it's my humble opinion that we should be conducting our important oversight and legislative missions here in D.C. in person, and I look forward to the return to regular order. Let me state that I find it disappointing that the majority did not invite ICE to a hearing that focuses on ICE. ICE could update us on the preventive measures they've taken to address COVID-19, the implementation of CDC and prevention recommendations, and further guidance they provided to detention facility contractors who will be joining us today. Under President Trump's administrative direction, ICE activated its pandemic workforce protection plan in January of this year in response to the COVID-19 outbreak. That plan provides an additional layer of safety measures on top of ICE's performance-based national detention standards. ICE also convened a working group of medical professionals, disease control specialists, detention experts, and field operators to identify further steps to protect detainees. As a result, the populations of ICE-dedicated detention facilities were reduced to 70% capacity. The CDC recommendation is 75%. This reduction included the review of nearly 34,000 detainees in custody nationwide to identify those with high risk of severe illness, potentially due to COVID-19. As a result, more than 900 detainees who posed a low risk to public safety were released. We can all agree that these are unprecedented times, and while I commend ICE for going above and beyond CDC guidance, there's certainly more that needs to be done. As of July the 7th, 3.7% of those in ICE custody, or 835 individuals, have tested positive for COVID-19. However, today in a hearing where we will heavily discuss the agency's response to COVID-19 and the threat thereof, ICE was not invited to testify. ICE should be here to update us on what further measures they're taking to address COVID-19, what additional improvements could be made. ICE should be here to tell us what issues have arisen and how they've overcome them or not. ICE should be here to answer questions about the new information we received from these contractors as a result of the chairman's very professional document production request. ICE should be before us today, but they're not here. Quite frankly, today's hearing topic is I respectfully submit, is outside our committee's jurisdiction, with this witness panel making it quite a stretch. Today, we have the presidents and CEOs from 4 government contractors who have to respond to repeated document production requests and testify before a committee with tertiary jurisdiction at best. Any legislation related to this topic, immigration detention and immigration laws, would not be referred to this subcommittee. On its face, it seems the purpose of this hearing is perhaps politically driven. Perhaps it's important to get the message out. I agree with the substance of what we seek, Madam Chair and Mr. Chairman, respectfully. I believe I should be here to speak for themselves. We create ever-moving goalposts for hardworking federal employees and contractors who are simply doing their jobs, abiding by the laws as prescribed by Congress. The truth is, nearly half of those in ICE custody on this day have final orders of removal, nearly half. The majority of individuals still in custody have either criminal convictions or charges pending, ranging from aggravated assault to homicide. These crimes committed in the United States are not taken lightly, and they shouldn't be. Yet some of my colleagues across the aisle seem to prefer that anyone detained by ICE should be released, no matter what crime that individual has committed or how much of a public safety risk they represent. It's completely righteous for us to question ICE's treatment and response to COVID-19, but let us not go too far. I hope we can cut through politics. The chairwoman and I have attempted to do so in the past. We shall continue that endeavor today. I look forward to speaking and listening, and I thank you, Madam Chair. I yield back.
I want to thank the ranking member, and also just add that it appears that DHS components are referring to an OMB guidance about avoiding remote hearings, which is why I believe they would not respond. But I would be more than happy to put the question directly to them, but that is apparently what we have been informed, that they are refusing to participate based on the guidance of OMB in any remote hearings. But I thank you for raising that issue, Mr. Ranking Member. Members are reminded that the subcommittee will operate according to the guidelines laid out by the chairman and ranking member in their July 8th colloquy. With that, I ask unanimous consent to waive Committee Rule 8A2 for the subcommittee during remote proceedings under the covered period designated by the Speaker under House Resolution 965. Without objection, so ordered. Without objection, members not sitting on the subcommittee will be permitted to participate in today's hearing. The chair now recognizes the chairman of the full committee, the gentleman from Mississippi, Mr. Thompson, for an opening statement.
Thank you very much, Madam Chair. Good afternoon to all the members present. I'm glad to have this opportunity to speak with our witnesses about this important topic, immigration detention contractors' response to COVID-19. The COVID-19 pandemic has brought illness and death to communities across our country, with more than 135,000 Americans losing their lives to coronavirus. My home state is not exempt. Over 1,200 of my fellow Mississippians have tragically succumbed to the pandemic, and cases continue to increase. This suffering has failed disproportionately on minority communities who often lack access to adequate health care. Those who reside in congregate settings, including detention facilities, are also particularly vulnerable. Even before the pandemic, many ICE detention facilities had a troubled record, with numerous complaints lodged about health and safety issues, poor living conditions, and inadequate inspections. These issues, combined with the risk of infection in any crowded spaces, can lead to outbreaks inside detention facilities. By the most recent reporting, thousands of ICE detainees across more than 70 detention facilities have tested positive for COVID-19. This unfortunately includes 35 detainees at Carnes Family Residential Center in Carnes City, Texas, which is operated by the GEO Group. This situation cannot continue. ICE and its contractors must do their part to slow the spread of COVID-19 in the interest of saving lives and protecting our country. I thank the witnesses for their replies to my April 29th letter requesting information on how they are mitigating the spread of COVID-19 in their facilities. However, I would note the production have only been partially responsive. I hope today to get a clear commitment from each company to be more transparent about their practices and what they are seeing in their facilities during this public health crisis. ICE has been publicly reporting on the numbers of affected detainees and federal employees, but a major gap in this reporting remains the number of contract personnel who've tested positive for COVID-19. The public deserves to know this information. The DHS Inspector General also recently issued an initial report informed by surveys distributed to facilities across ICE's detention network. Those surveys allowed facilities to self-assess their preparedness and response to the pandemic, but there appeared to be a disconnect between issued guidance and implementation of that guidance. Similarly, my staff found serious implementation gaps when reviewing the documents each of your companies provided in response to my requests. We've seen public reporting and heard from whistleblowers across the aisle concerned with how ICE private contractors are managing this situation. I ask for unanimous consent to enter into the record a letter from the Government Accountability Project, which represents multiple whistleblowers who are alarmed by LaSalle Corrections operation at the Richwood Correctional Center in Louisiana. The Government Accountability Project also represents subject matter experts who are employed by DHS to advise on detention health issues, but whose input seems to have been ignored. The letter describes extremely concerning mismanagement that no doubt has made the crisis unfolding in ICE detention facilities that much worse. This is not the end of this committee's oversight of conditions at ICE detention facilities during COVID-19. Even before the pandemic, the committee was actively examining persistent problems at those facilities. That work will continue. Today, I urge each one of ICE detention contractors to be more aggressive in their response to COVID-19. I also hope that as the tragic public health crisis continues that ICE will use its discretion and maximize the use of alternatives to detention program, which the GEO Group has managed for years, to limit the spread of COVID-19 in detention. I urge our witnesses to re-examine how they approach the problem of COVID-19 within their facilities and to continue their engagement with us to improve these conditions. Thank you, Madam Chairwoman. I yield back.
Thank you, Mr. Chairman. The chair now recognizes the ranking member of the full committee, the gentleman from Alabama, Mr. Rogers, for an opening statement. Mr. Ranking Member, you need to unmute.
How's that? Thank you, Madam Chairman. I want to thank Chairman Thompson again for the use of the committee room. During this Congress, the majority has made it a habit of declining to invite or refusing to accommodate critical government-backed witnesses. Today's no different. We reached out to DHS to find out why they weren't here, and they said they didn't know about the hearing until we called them last week. The majority failed to invite ICE to answer questions about its detention policies. I'm increasingly concerned that this is a concerted tactic to avoid having experienced senior officials from DHS at our hearings to counteract increasingly left-wing narratives. On the subject of today's hearing, I remind the majority that just last year, they called the migrant surge at the border a fake emergency, even as the crisis reached its peak. On the subject of House Democrats waited more than a year and a half to vote on a much-needed emergency funding for border crisis, and what they did send came up short. Not one single dollar for immigration and customs enforcement detention capacity was included. ICE requested over $300 million to modernize and improve its detention capacity to meet the spike in demand, and the majority didn't send a dime. Meanwhile, Customs and Border Protection was forced to release migrants straight into border communities. The goal of the majority, I don't know. It's becoming increasingly clear that calls for open borders are seeping into the mainstream Democrat Party platform. Contractors like the ones before us today have helped meet the government's detention needs. They are often derided for simply partnering with the federal government to carry out the laws of this land. These contracts have existed under both Democrat and Republican administrations. During the COVID-19 crisis, ICE and its detention partners have worked together to reduce the number of individuals in custody. They've taken measures that go beyond CDC guidance to adapt to the new safety protocols and cleaning procedures. They've also provided safe accommodations for those with final removal orders or criminal convictions whose release would endanger our communities. The border crisis and COVID-19 crisis are two sides of the same coin. I question how the majority can continue to neglect its duty to fund ICE last year and again this year. The border crisis and its lack of funding foreshadows the COVID-19 health crisis. Willfully underfunding ICE to make a political point to the base of the Democrat Party will have profound impacts on migrants drawn here by our broken immigration systems. Failing to invest in agencies that enforce our immigration laws has broad consequences. I hope the majority will ultimately realize their continued efforts to defund ICE have lasting consequences before we have a repeat this hearing again next year. Thank you, Madam Chairman. I yield back.
Thank you, Mr. Ranking Member. I will now welcome our panel of witnesses. Our first witness is Mr. Damon Hinninger, the President and Chief Executive Officer of Core Civic. Mr. Hinninger joined the company in 1992 as a correctional officer based in Kansas and served in a number of roles until he was named CEO in 2009. Our second witness is Mr. George Zoley, the Chairman of the Board, CEO, and founder of the GEO Group. Mr. Zoley founded the company in 1984 and has served as CEO since it went public in 1994. He also serves as a director of the GEO Group's various subsidiaries. Our third witness is Mr. Scott Marquardt, who is the president and CEO of the Management and Training Corporation, or MTC. He has been at MTC for 37 years. Our final witness is Mr. Rodney Cooper, the executive director for LaSalle Corrections. Mr. Cooper retired from a 30-year-long career at the Texas Department of Criminal Justice before joining LaSalle in 2009. He has also been a member of the American Corrections Association. Without objection, the witness statements will be inserted in the record. I now ask each witness to summarize his statement for 5 minutes, beginning with Mr. Hinninger.
Thank you and good afternoon, Chairwoman Rice, Ranking Member Higgins, and members of the subcommittee. My name is Damon Heiniger, and I'm the President and CEO of CoreCivic. For over 35 years, CoreCivic has worked with our federal and state partners to provide safe, respectful, and humane environments for those individuals housed at our facilities. I have been with the company for more than 28 years. I began my career as a correctional officer with the company in Leavenworth, Kansas, where I was born and raised. After starting as a correctional officer, I have worked in nearly all areas of corrections. My experience in our facilities informs my actions every day. At CoreCivic, we take seriously our responsibility to ensure the people entrusted to our care are safe and treated in a humane manner. The COVID-19 global pandemic is an unprecedented situation that has presented challenges to every correction system in America, public or private, just as it has for other organizations such as hospitals and nursing homes, where individuals are housed together or share common accommodations. During this time, our number one priority is the health and safety of those entrusted to our care, our employees, and our communities. Throughout the company's history, we have implemented industry best practices to handle the potential spread of infectious diseases. Since the pandemic began, we have worked quickly to execute the guidance of the CDC and our partners. I believe these practices and the measures CoreCivic has implemented in our facilities have prevented further transmission of COVID-19. Beginning in February, we started monitoring the development of COVID-19 nationally and in our facilities. In March, we activated our Emergency Operations Center, or EOC, which functions 24 hours a day, 7 days a week. The EOC serves as a central point to help coordinate our response and support our facilities. Coordination and communication across the company has been critical, and the guidance from the CDC and our partners have evolved over time as we have learned more about COVID-19. We also formed a COVID-19 task force comprised of senior operations and medical leaders to monitor the pandemic and develop facility-specific response and medical action plans. We quickly pushed out guidance on good hygiene practices. At our facilities, our staff works constantly to educate those in our care about how to combat the spread of COVID-19. Consistent with the CDC's recommendations, our staff are required to wear masks, and we provide masks to both our staff and detainees in our ICE facilities. These masks are replaced as necessary, and we have an adequate supply of masks stocked at our facilities. CoreCivic also screens all individuals and employees before entry to our facilities. These screenings include temperature and COVID-19 symptom checks. The realities of the pandemic have required us to make certain operational changes at our facilities. For example, working closely with our government partners, we suspended in-person visitation in March. Following the guidance of the CDC and ICE, CoreCivic separately houses from the general population any detainee who tests positive for COVID-19 or who is exposed to a positive case. We have also adjusted how we serve meals and provide other services to promote social distancing and reduce the risk of transmission. Our staff understands that while these steps are necessary to stop the spread of the virus, these changes can be stressful to the detainees and their families. To address this, we have provided additional virtual communication through phones and other means, including adding additional free call minutes. Where it is safe to do so, we have preserved detainee activities. We hold town hall meetings to share information with detainees, answer their questions, and listen to their concerns. CoreCivic's website has a dedicated section for families with information about CDC guidance and visitation. The health and well-being of our nearly 14,000 CoreCivic employees is a top priority. We recognize that reporting to work during the global pandemic can be stressful for our employees. We expanded paid leave to those who have to miss work for COVID-19 related reasons. We offer accommodations to employees who may face an elevated risk of complications from COVID-19 and wish to take extended leave. To recognize CoreCivic employees' service during the pandemic, each facility employee, including part-time employees, received a $500 hero bonus and additional time off. COVID-19 continues to threaten our nation and affect Americans in every region and working in every industry. We continue to work every day to reduce the risk of transmission, care for those who live and work in our facilities, and make every effort to improve our practices and procedures. I thank you for the opportunity to testify today and look forward to your questions.
Thank you. Thank you for your testimony. I now recognize Mr. Zoli to summarize his statement for 5 minutes.
Thompson, Chairwoman Rice, Ranking Members Rogers, Ranking Member Higgins, and distinguished members of the subcommittee. Thank you. I was born in 1950 in Florina, Greece, located on the northwestern border of the country, in a house with no plumbing or electricity. Also in the house where I was born were Greek soldiers who were spending the night resting from fighting communist partisans from Yugoslavia and Albania. Fortunately, in 1953, my family received approval to immigrate to the United States, where we traveled by ship, landing in New York City, and where we were processed through Ellis Island. We settled in Akron, Ohio, where I learned to speak English and began my education that eventually took me to Kent State University during 1968 and 69. My own immigrant story has shaped the core values that have guided my entire life and career, which include the principle of never placing profit above the value of people. I am chairman and CEO and the founder of the GEO Group, which I established in 1984. 4 of our 9 board of directors are either female or members of a minority group. We have 23,000 employees in locations in the US, UK, Australia, and South Africa. 60% of our employees are members of minority groups, reflecting our company's diversity. 93% of our employees who work in our secure services division earn $15 an hour or more. Now, I would like to address some things that our company does not do. We don't manage any shelters or facilities for unaccompanied minors. We don't manage any facilities with chain link fencing in housing areas. We don't play a role in who's assigned to a facility under our management. And we don't lobby for stricter criminal justice or immigration laws. In my written submission, I have chronicled the numerous company steps taken to fight COVID-19 virus, but here I will only summarize our response. We believe we've acted quickly and effectively to protect the health of those in our care and our employees. I'm pleased to report that there have been 0 COVID-19 deaths in GEO-managed facilities for ICE. Further, there is only 1 detainee and 1 employee who are presently hospitalized. In early February, we began posting information throughout our facilities on the importance of social distancing, proper hand washing, and sanitation practices. COVID-19 specific cleaning supplies and hygiene products have been continuously available in all housing units. All detainees and employees are supplied with masks. High-risk residents were identified and placed in separate housing units with specialized health care protocols. Improved social distancing has been made possible to our ICE facilities operating at less than 50% occupancy. We have an ongoing COVID-19 testing program for residents and employees, which will expand in September when we expect to receive 45 Abbott COVID-19 test machines. We will continue to apply best practices to improve our effectiveness in fighting this virus. This concludes my opening remarks. I appreciate the opportunity.
Thank you, Mr. Zoli. Thank you for your testimony. I now recognize Mr. Marquardt to summarize his statement for 5 minutes.
Thank you for the opportunity to appear in today's hearing. My name is Scott Marquardt, and I'm the CEO of Management and Training Corporation. I would like to share my company's experiences responding to COVID-19 in the 5 detention facilities we operate in California, New Mexico, and Texas. Since the start of this pandemic, our top priority has been to take actions that protect the detainees and our staff from this virus. MTC began in 1981 as an operator of residential Job Corps centers. We provide low-income youth with academic instruction and technical training, as well as wraparound services, including food, shelter, medical care, mentorship, and job placement. We've made a positive difference in the lives of hundreds of thousands of vulnerable youth. In 1987, MTC took our Job Corps knowledge and experience and began operating correctional facilities with the goal of helping incarcerated individuals change their lives and reducing recidivism. In 2006, MTC began providing services to another vulnerable population, the men and women detained pending immigration proceedings. MTC again adopted the Job Corps model of support, service, training, and respect. MTC-operated detention facilities provide access to healthcare, legal, programming, and faith-based services in safe, clean, and secure facilities. As of today, there are a total of 6 active COVID cases at our facilities. COVID-19 has proven to be highly contagious, and medical guidance has been fluid since the start of this pandemic. We have acted with urgency to implement the guidance from ICE, the Centers for Disease Control and Prevention, and state and local health departments. We have a deep concern for the people at our facilities, and our highest priority is the safety of our staff and detainees. We are responsive to evolving federal, state, and local guidelines. We currently screen all new entrants to our facilities by placing them in a 2-week quarantine. We test individuals who are symptomatic or have had contact with someone with COVID-19. Individuals who test positive are placed in medical isolation and provided with care. Employees and those entering the facility are screened prior to entry. Staff and detainees receive training to identify symptoms and to help them understand prevention behaviors like hand hygiene, cough etiquette, social distancing, and mandatory mask-wearing procedures. Cleaning and sanitation is enhanced, and social distancing practices are in place. We've learned a lot about containing the spread of COVID-19 the past few months. While there still is a lot that we and the entire medical community don't know, there are some things that guide us. First, testing is a good management tool that gives us important information to act on. It is not a panacea. Changing behavior is the difference maker. Frequently educating detainees and staff on prevention behaviors is essential. Limiting movement of detainees into facilities and having space to isolate, cohort, and quarantine help significantly. Stopping in-person visits, except for legal visits, and screening those entering the facility make a difference. And finally, cleanliness and good sanitation, and insistence on social distancing, mask wearing, and hand washing is critical. We will continue to evaluate and apply lessons learned in managing COVID-19 at our facilities. I would like to close by thanking the people who work day in and day out on the front lines of this pandemic, risking their own lives to keep the men and women in our care safe and healthy. It's the officers, doctors, nurses, counselors, chaplains, food service workers, facility administrators. They are heroes, and we couldn't have managed this unprecedented pandemic without them. Thank you for allowing me to speak about our shared interest in successful outcomes for the people in our detention facilities.
Thank you for your testimony, Mr. Marquardt. I now recognize Mr. Cooper to summarize his statement in 5 minutes.
Thank you, Chairman Thompson, Ranking Member Rogers, and members of the committee. Thank you for the opportunity to testify regarding our COVID-19 response. It is a privilege to appear before you today and discuss the tremendous efforts our company is taking to mitigate impacts of this unprecedented pandemic. LaSalle Corrections is an established developer and operator of correctional centers throughout the United States. LaSalle Corrections has been providing corrections industry solutions to law enforcement agencies, federal agencies, and government municipalities for decades. A range of facility solutions include design, construction, and operations management, along with inmate and detainee services that cover security, education, rehabilitation, immigration, and healthcare. As a full-service corrections and immigration detention management provider, LaSalle Corrections specializes in the management of prisons, jails, and detention facilities, as well as inmate and detainee transportation services. Since the onset of reports of COVID-19, LaSalle Corrections has been tracking the outbreak, regularly updating infection prevention and control protocols, and issuing guidance. We implemented our pandemic contingency plan in response to COVID-19 that includes screening, testing, appropriate treatment, prevention, education, and infection control measures. After thorough review and consultation of existing plans, we formulated revisions to our strategic plans to include a COVID-19 response plan. Our company's strategic planning ensures for continuity of operations and a sustainable healthcare delivery system. All emergency services and advanced medical care is included in our pandemic planning. Also, comprehensive protocols are in place for protection of staff and detainees, including the appropriate use of PPE in accordance with CDC guidance. As you're aware, correctional and detention facilities can include custody, housing, education, recreation, healthcare, food service, and workplace components in a single physical setting. The integration of these components presents unique challenges for control of COVID-19 transmission among incarcerated persons, staff, and visitors. However, our company's consistent preparation, prevention, and management measures have served as a foundation to reduce the risk of transmission and severity of illness from COVID-19. To date, no one in our care and custody has succumbed to COVID-19. Our employees have access to the most current CDC and DHS guidance and full support and assistance in this rapidly changing environment. General guidance for each facility on COVID-19 and correctional detention settings include operational and communications preparations for COVID-19, enhanced cleaning, disinfecting, and hygiene practices, social distancing strategies, how to limit transmission from visitors, infection control, including recommended PPE and potential alternatives during PPE shortages, verbal screening and temperature check protocols for incoming individual staff and visitors, medical isolation of confirmed and suspected cases and quarantine of contacts, including considerations for cohorting when individual spaces are limited, healthcare evaluation for suspected cases, including testing for COVID-19, clinical care for confirmed and suspected cases, considerations for person at high risk of severe disease from COVID-19. We are working closely with the Center for Disease Control, the Department of Homeland Security, and other federal, state, and local agencies to facilitate and refine our pandemic planning. LaSalle Corrections reviews CDC guidance routinely and continues to update protocols to remain consistent with CDC guidance. We will continue to incorporate CDC's COVID-19 guidance coupled with the rapidly changing adaptations of state and local health departments. Also, LaSalle Corrections continues our focus on operational and communications planning, reinforcing hygiene practices, intensifying cleaning and disinfecting of facilities, and monitoring for potential cases. Facilities will continue to increase social distancing, having staggered meals, meal locations, and rec times in order to limit large gatherings. The responsibility to protect those in our custody is paramount, and LaSalle Corrections is firmly committed to the health and welfare of our detained population. LaSalle Corrections will remain diligent in operating our facilities at the highest level, providing safe, secure, and humane surroundings for our staff, those in our custody, and the communities in which we operate. The skills, talents, and dedication of our workforce form the foundation of our success in responding to this unprecedented pandemic, and I assure you, our team will continue to work very hard every day to ensure facilities are operating under the safest and most practical conditions to reduce the risk of exposure and prevent further spreading of COVID-19. Thank you again for the opportunity to appear before you today and for your support. I remain committed to working with Congress and my colleagues to ensure for the continued welfare and safety of our detained population.
Thank you, Mr. Cooper. I thank all the witnesses for their testimony. I will remind the subcommittee that we will each have 5 minutes to question the panel. I will now recognize myself for questions. Mr. Heininger, first to you. At the Eloy Detention Center in Arizona, which your company operates, at least 250 detainees have now tested positive for coronavirus among an average population of about 1,100 people. That's nearly 5% of the detainees at the facility. There are also reports indicating that employees have been pressured to keep working after showing signs of the coronavirus, and that staff are not told when other workers or detainees have tested positive for the virus. Will you commit to launching an investigation into these reports of potential negligence at the Eloy facility?
Thank you for your question. So let me just first say that, since the beginning, we've been working closely with ICE, our partner in this case, and also CDC, receiving their guidance on exactly how we should adjust and calibrate our operations appropriately within our ICE facilities. And that's informed our operational kind of plan and process during that period of time. As relates to Eloy out in Arizona, we have had individuals test positive that you just noted, both staff and detainees. The numbers I think you've indicated probably are kind of year to date or during a period of time. We've had the pandemic. They're lower today. In fact, I would say there's probably about 90 employees, I think, today that are positive with the COVID-19.
I'm so sorry to interrupt you, but I have only 5 minutes. I just wanted to ask if you could, yes or no, would you agree to open up an investigation into those allegations?
Well, we don't have to wait to investigation. I mean, we're looking at these in real time. And ICE, as you know, has staff actually on site that's working with us. So if it's appropriate, or we need to make a change or a tweak or enhance our processes, we're doing that in real time and not waiting for an investigation.
So one of the first pieces of guidance that was issued by the CDC was, if you feel sick, stay home. They said that to every single American: if you feel sick, stay home. So I just want to ask all 4 witnesses, yes or no, because I have very limited time. Will each of you commit here today that you will let your staff stay home if they are experiencing symptoms, if they are not feeling well? If all of you could just answer yes or no.
Yes.
Yes, we did that weeks ago.
Yes.
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 Thank you. Thank you. We know that ICE detainees are still being transferred between detention facilities around the country, which is inevitably contributing to the spread of this virus. Have any of your, again, yes or no, have any of your companies ever requested that ICE halt transfers to your facilities due to safety concern?
No.
Everyone else?
For MTC, we are in constant communication on safety concerns of inmates being transported. We have a dialogue back and forth. If we get somebody with a temperature or anything, we immediately stop the transfer, and we are regularly in dialogue about that issue.
So if you get someone who actually appears to be having symptoms, you immediately put them in isolation once they come to you? You don't refuse them to take them from ICE?
Well, if they show up on the bus, they are held at intake, isolated, until we get on the phone with ICE and determine the proper course of action, whether they need to go to the hospital, they need to go back somewhere else, or what's going to happen. And that happens on a regular basis. So yes, we're constantly in communication about this subject.
Yeah, CoreCivic, I mean, it's consistent, probably the other operators. We have medical staff going out to the bus and actually doing screening on the bus before they walk in the facility and determine if they are, showing symptoms or have a higher temperature, I should say, then we're isolating as appropriate for additional medical direction.
And we do the same.
Anyone else?
LaSalle does the same as what was just mentioned.
I know other members, other of my colleagues are going to be asking about testing, because we know that is, without testing, we're never going to be able to get this issue under control. So I guess, yes or no, are you being left to acquire the testing? I know one of the witnesses said something about getting 45 Abbott machines soon, but are you responsible for getting your own testing, or are you getting that from DHS, ICE?
This is George Zolli of the Geo Group. We are generally responsible ourselves for getting the test equipment.
And are you having difficulty doing that?
In the early stages, absolutely, to a lesser extent to date. ICE did provide us 2 Abbott machines at 2 facilities about a month ago, but more recently, in the last few days, we've been able to contact the Abbott Corporation and get confirmation of receiving 45 machines in September, which we're very pleased.
We have been responsible for getting our own tests. We have been able to keep up with the requirements of CDC and ICE from the beginning, although those requirements have changed. And in the beginning, that we weren't required to use as many tests as we are today. So today we are getting an adequate supply of tests, but we've been notified by suppliers that looking forward, that could change. The testing supplies are being deplenished right now because of the outbreak in so many states across the country. So we are actively searching for backup supplies of tests right now. So we're fine today, but concerned about supplies going forward, particularly if the expectation for higher levels of testing become the guidance.
Okay, thank you all. I want to thank you for your testimony here today, and I now recognize the ranking member, the gentleman from Louisiana, Mr. Higgins.
Thank you, Madam Chairwoman. Mrs. Zoli, if you could respond to this question, sir. I understand you have no role in setting or enforcing immigration policy, but according to our research, groups have targeted your company specifically because you provide contracted services to ICE. And it's my understanding that some of your facilities have been subject to some sort of vandalism and attack. Can you tell us a little bit about that, please?
Yes, we've had facilities in Colorado, Washington, and California that have undergone not only large-scale protest demonstrations, but destruction of property. We've had shootings in Tacoma, Washington, in our regional office in Texas. It's just unbelievable, the level of
Have you, and thank you for your response in the interest of time, have you responded with enhanced security? Have you felt the need to respond with enhanced security at your facilities?
Yes, we've spent millions of dollars in additional fencing, better coordination with local law enforcement and our host communities. And we think we have a better situation now than we did before.
Excellent. Would you feel that you could say that that your facilities were targeted because you do contract work for ICE, because it doesn't appear to be happening to other facilities that do not have a relationship with ICE?
It would seem to be so, and it's unfortunate because we think our facilities are very new, excellent physical plant facilities with air conditioning and all the amenities described under the Obama administration. And we're doing the same things we've done for years, and we don't understand the need for these protests.
Well, thank you, sir. These are difficult times. It's a passionate consideration in our country, and folks get emotional. But we must maintain law and order. So I encourage you to pursue that in a compassionate manner. Mr. Marquardt, you described your systems as being, in my opinion, I would summarize it as saying that you have a very proactive response to COVID-19. You mentioned some procedures that have been put in place that are very impressive, in my opinion. What would you say your percentage is of COVID-19 testing? I do not have a copy of your written testimony in front of me, and I did not hear you mention that. What percentage of your population is tested? According to your guidance.
We are
According to your guidance, yeah.
We are following the guidance of CDC and ICE. So anybody who exhibits symptoms would be tested at New Mexico, the state of New Mexico, and this congressional delegation, Representative Torres Small, the governor, and others on the delegation have been very interested in this topic. And cooperatively, they have helped us enhance our supply of tests, and we are testing we have tested every single detainee in the facility and continue to test every detainee that comes into the facility.
So you're testing 100% of your detainees?
At that facility.
At that facility?
Yes.
Do you know of any business or governmental entity that is testing 100% of their population and their staff? I don't know.
I can't give you one, but I imagine there are. Well, I mean, in terms of a regular business, no.
An incarceration facility.
It's widely being discussed as a possible solution for the future. There's a lot of discussion about it. I don't think it's happening too many times in terms of the availability of tests. It's probably not practical right now. One of the problems with testing is...
Well, that's one of our endeavors, good sir. And again, in the interest of time, it is for this subcommittee to help to make it practical, because it's what we seek across the aisle. We have a great deal of agreement that increased and enhanced testing should become the norm. We shouldn't be talking about testing, 5, 10, 20% of our incarcerated children of God. We should be pushing to get to 100%. And I encourage you, gentlemen, all to work with Congress and your contracts to make that happen. Mrs. Zoli, my final question, and I'm not sure how much time I have left. You've been providing services to federal and state local agencies for more than 30 years. During that time, as a partner to federal agencies under Democrat and Republican administrations, if your services were not available to federal agencies as you serve, what would be the result absent a change in immigration law? What if your services were gone? Tell us the impact.
If the private sector was not playing the role it is playing today, the federal government would have to hire thousands of new employees and spend several billions of dollars building new facilities, which would take many, many years to accomplish if they were to do so.
I appreciate that summary. Madam Chair, it's been mentioned to me that perhaps we'll have a second round. I do have additional questions, but in respect to the time of my colleagues, I yield.
Thank you, Mr. Higgins. And if we do have time, we will be doing a second round. I now recognize the chairman of the committee, the gentleman from Mississippi, Mr. Thompson.
Thank you very much, Madam Chairman. And for our witnesses, I really appreciate your companies providing the committee with the documents that we had requested. Can each of you tell us how many employees you had tested positive for COVID-19 to date? Mr. Henninger, Mr. Zoli, Mr. Marquardt, and Mr. Cook.
For Core Civic, we have about 14,000 employees, of which about 500 employees have tested positive.
Dan.
If I could just interrupt for 1 second. We are having an issue with the live feed, so we're going to take a very short recess. Please, everyone, just stay where you are if you can, so we can get the technical issue addressed. Thank you very much. let everyone know that we are going to be up and running in 5 minutes. So hopefully everyone can get back online so we can restart the hearing. Thank you. The committee will reconvene. The chair recognizes the gentleman from Mississippi, Mr. Thompson, to continue his questioning.
Thank you very much, Madam Chair Lady. Mr. Henninger had responded to my question, and I was going to Mr. Zoli.
I honestly forgot the question. Sorry.
Well, we were talking about the number of employees that you had impacted by COVID-19.
Sure. We have approximately 3,700 employees at ICE facilities. We've tested 991. 167 were positive, but 69 have recovered. 864 were negative. There was only one GEO staff member in the hospital at this time. There have been 0 COVID-19 deaths among staff. All staff receive wellness training daily upon arrival in the facility. Any staff not cleared are denied entry into the facility and are sent home and advised to be tested by their physician.
Thank you very much. Mr. Marquardt.
We have 1,200 employees at the detention facilities that we operate, and 73 of them have tested positive.
Mr. Cooper.
Yes, sir. We have just over 3,000 employees. The cumulative number of staff who tested positive was 144.
Thank you very much. Did this, we'll go back around again for the question. Did this testing positive impact your ability to staff the facility, or do you have a plan in place to manage COVID-19 related shortages?
This is George Zoli at the GEO Group. That situation has not impacted our ability to have adequate staffing, primarily because we're at 50% occupancy or less. So the staffing that necessary is substantially less.
Thank you. Mr. Henninger.
Yes, sir. It's a very similar answer. Yeah, our occupancy in our ICE facilities is kind of in the range of kind of 50 to 75% occupancy. So that has affected staffing in a positive way. And additionally, we've got a lot of our facilities in close proximity with other facilities that house ICE detainees. That gives us flexibility to move staff between facilities also.
Mr. Marquardt.
Similarly, we have not had a problem staffing our facilities.
Mr. Cooper.
And I would say the same as the others. We have facilities that are close enough that we can pull staff if needed from other facilities.
Okay, well, the fact that you have a population that you're managing that is highly potentially contagious, how do you determine which employees get tested? Mr. Henninger first.
Yes, sir. So we do testing every day, at every shift, I should say, for every employee that comes in the institution, both a temperature check and then also a symptom check. And if an employee is not cleared when they enter the facility, then they're asked to be sent home. They're told that no worries about their job or their salaries or benefits, but stay home. It does appear that potentially you have symptoms for COVID. Typically, within a day or two, they get tested. If they are positive, then obviously they follow the guidance of CDC, which is 14 days of being self-isolated at home. And again, does no adverse impact to their employment or salary and benefits. So we've made that commitment to our employees.
Thank you. Mr. Zola.
My response is similar, Mr. Chairman, with the exception that we have at 9 facilities done saturation testing. That is testing all detainees, all staff. and we're asking for permission from ICE to do the same at our other facilities.
Thank you. Mr. Marquardt?
We do similar screening of all employees entering the facility, temperature check, asking if they've traveled anywhere or had symptoms, the same questions. In terms of a COVID-19 test, tests would be available to employees who exhibit symptoms, who have had exposure to someone with COVID-19. And the availability of tests for employees in the community varies greatly by community, but in many communities, it's been fairly easy that anybody that's nervous at all doesn't really have to have a reason, can just go into a clinic or a setup in parking lots or wherever they are and get tested. So there's been good availability, and we're following the guidelines of ICE and CDC in testing.
Okay. Well, yeah, I understand that, but I'm talking about for your employees who come to work. Do you have a specific protocol for them, not out in the community, but?
Yes. We do the same screening, so they would be screened at the entrance to the facility. They cannot enter the facility until they've tested or had a temperature check. If they're 100.4 or above, they cannot enter the facility. And we go through a variety of screening questions every time they come into the facility to check that.
Mr. Cooper?
Yes, sir.
I beg pardon?
Can you hear me now?
I got you now.
Okay, it's showing to still be muted. I don't know why. Yes, sir. We do the same sort of screening with every employee that comes in and make sure they are not allowed in if they don't pass that screening. We have done employee saturation testing at one facility, but that was just last week, and we don't have all those results back.
No. Thank you very much. I yield back, Madam Chair.
Thank you, Mr. Chairman. I now recognize the ranking member of the whole committee, the gentleman from Alabama, Mr. Rogers.
Thank you, Madam Chairman. Can you hear me? All right. Mrs. Zoli, we all recall the tremendous challenges that organizations in our country and around the world were facing due to shortages of personal protective equipment back in March and April. In fact, many organizations are still facing those same challenges. But I understand that you were able to deploy PPE to all staff and detainees at your ICE facilities very early during this pandemic. Can you share with us how you as a private sector company were able to work with your suppliers to ensure enough PPE for all your detainees and employees early in the pandemic?
I think it's primarily because we're potentially a large-scale user, so we were able to place very large orders of hundreds of thousands of masks and gloves with vendors who wanted our business, frankly, and they gave it to us, I guess, before they gave it to somebody else.
Yeah, I've heard reports of that around the country. Mr. Marquardt, we're constantly learning new information and abiding by updated guidelines, guidance throughout this pandemic. When new guidance is issued or a problem arises at one of your facilities, what processes or procedures do you have in place to address or resolve those new guidances or new problems?
In terms of COVID procedures?
Yes.
Well, it's a weekly, if not daily occurrence that new information's been coming out, and we change procedures accordingly. We have an incident command structure similar to Mr. Heiniger explained was going on at CoreCivic, but in early March, we implemented the incident command system at all of our facilities and as a corporation. And so it's on a daily basis. We're making sure that supplies are available to all of our facilities, that there's a command structure in place for any issues that come up, that we have a plan, an action plan for what needs to be accomplished that day or that week. And so that's how we monitor supplies. We have a medical director that's monitoring CDC every day on what new guidance comes out, and through our incident command system, we relay that to all of our facilities, and they've done a phenomenal job in reacting. We haven't really had any problem with staff or detainees in terms of, I mean, this is an inconvenience to everybody, but everybody through education and training, we explain the importance and how critical this is, and people pitch in and go the extra mile to do whatever we ask and whatever CDC guides us to do.
Great. This will be for each panelist. I've heard the word overcrowded used or misused as it relates to ICE facilities during the pandemic, but it's my understanding that all ICE dedicated facilities have been operating at 70% or less. Could each of you address the issue of capacity at your facilities and share how your facilities are abiding by CDC guidance based on that capacity? I'll start with Mr. Zoli.
As I said previously, Representative, our facilities are less than 50% capacity. So that permits us to have improved social distancing in dormitory-style housing, as well as cell room-style housing, as well as rooms for occupancy of 4 or 8 individuals. We can split all those things into half and separate people into alternating bunks, alternating rooms, alternating housing units. So it's worked very well.
Mr. Henniger.
Yes, sir. So we have about, in round numbers, about 17,000 beds that we have available to ICE on any given day. But typically operational occupancy is anywhere from kind of 9 to 11,000 historically. But today we're under 6,000. So yeah, we're pretty close to about 50% occupancy. So that's obviously pretty consistent with CDC guidance relative to lowering occupancy and density, and allow us greater flexibility, not only staffing, but also for detainees for social distancing.
Okay, Mr. Marquardt.
Before the pandemic began, there was already a very rapid decline in ICE populations underway, and that has continued every month of this year. So our populations are right now at 34% of occupancy, or full occupancy. So we have quite a bit of room for social distancing, for cohorting, for isolating individuals or groups of people that come in on different days on different buses. So we really have not had a problem with that. ICE has taken pretty much all of the high-risk detainees out of the population. So today, any detainee over 55 years of age or that has any chronic condition will not come into one of our facilities. So all of these things have added to help us in dealing with the pandemic.
Right. Thank you. My time has expired. Yield back, Madam Chairman.
Thank you, Mr. Rogers. I now recognize the gentleman from New Jersey, Mr. Payne. Mr. Payne on? Okay, I now recognize.
Hello, I'm here.
He is, thank you.
Thank you. Madam Chair, I appreciate the opportunity to speak today, and what I feel is a very timely topic for the committee to explore. Let me say, even before the pandemic, detainees had reported troubling instances of use of force, solitary confinement, and punishment in retaliation for speaking out about poor conditions of confinement in at least one of each of your detention facilities. Since COVID-19 pandemic, reports of such retaliatory action have grown more frequent, including at least 12 instances of use of tear gas, pepper spray, rubber bullets, and SWAT-like units. Hey, are your contract guards carrying pepper spray and tear gas? I'd like each to respond, please.
Sorry. William.
I'll respond for MTC. I'm not aware of the incidents that you're talking about. We have Our detention officers do not carry pepper spray. We have it on site if there were an incident that we're prepared to handle it, but we have not discharged it and have not had that problem. I mean, I regularly visit the detention facilities. I talk to detainees, hundreds of them, and I always ask, how are you doing? I ask about their stories, how they've been treated, the food, the medical care. And, generally it's a very positive story and they're appreciative. I mean, we treat them with respect and dignity, and they're very appreciative of that. I mean, they're in a crisis. Go ahead.
Thank you for that answer, but I have a few more to get through. Next, please.
So Damon Heiniger, and so no, pepper spray or pepper gas is not carried on the individual. But I think it's important to note that we follow ICE detention standards, so it governs what our employees are able to carry while they work in institutions. And the second is ICE has staff on site full time that are inspecting operations in real time.
Thank you.
This is George Zolli from the GEO Group. My answer is similar to Damon's, and that is our staff individually do not carry pepper spray. It is available in access from a special location, but it's only done so with the approval of ICE, who is on site.
Thank you. Next.
And this is Rodney Cooper with LaSalle, and my answer would be much like Mr. Heiniger's. We do have it available if needed, but we do follow all of ICE's standards in regards to the use of any chemical agent.
Okay, thank you. Are you aware that according to medical experts, irritants such as the pepper spray induce coughing and increasing a person's chance of catching a respiratory illness such as COVID-19? Does anybody,
Not to the latter. This is George Zolli from the GEO Group. I know we go through special healthcare protocols when pepper spray has been used. Everybody is taken into the healthcare unit, for examination and treatment if necessary. So we know that it may cause some kind of illness or some side effects, and therefore we do proactively engage the residents to go to medical and get a thorough screening. But I wasn't aware it could have an effect on COVID-19.
Okay. Well, let me ask something. I'll go another. So no one is aware of any time that rubber bullets or pepper spray or tear gas has been used by officers at your facilities against detainees since the COVID-19 pandemic? Are you all categorically denying it?
Yes, MTC has not used any of those devices since the pandemic began, no.
Okay, thank you.
Same for Core Civic, absolutely not.
Thank you.
This is George Zolli from the GEO Group. We had an incident at our Adelanto, California facility where chemical agents were used.
Okay, all right. Yeah, and is one more gentleman? Did I get everyone?
Rodney Cooper with LaSalle, and I'm not aware of any use of chemical agents since COVID-19.
Okay, all right. Well, I'm glad one gentleman acknowledged that there was an issue, because I know I wasn't crazy or just making it up, but okay. Detainees at, it was Torrance County facility in New Mexico, were on a days-long hunger strike to protest the horrible food and their vulnerability to COVID-19 when guards reportedly corralled the protesting detainees and then proceeded to pepper spray them. There are similar accounts from facilities across the U.S. Let me just say that there's been a difficult seems issue with the definition of detainees. They're not convicts, they're being detained. And I think what happens is the lines get blurred, you know, to one person being a convicted criminal as a detainee. I would hope that all of you can clarify to your staffs the difference between the two and act accordingly. Because I don't think people are just making these things up. Something is happening. Now, maybe at times it gets blown out of proportion, or by the time it gets to the fifth person, it's exaggerated, maybe, or maybe not. Maybe these things are happening. I would really suggest to you that you keep a strong oversight on these issues, because if and when we find out otherwise, there are going to be repercussions that I don't think any of you would like to see or appreciate. And with that, Madam Chair, I'll yield back.
Thank you, Mr. Payne. I now recognize the gentlelady from Arizona, Ms. Lesko.
Thank you, Madam Chairman. And I want to thank all of the CEOs that have come to testify today. We're all in this thing together, and it's been difficult. It's been difficult for not only, I'm sure, your companies, but for hospitals, for nursing homes, for all of us. So I can see the sincerity in your voice when you say that you're doing everything that you can to protect your employees and the detainees. And so thank you. I do want to ask a question or give an opportunity to Mr. Heininger, who is with CORE. And I went down to the Eloy facility, this was a while ago, it was pre-COVID, and I thought it was run well. But in the news recently, that facility in Eloy, Arizona has been in the news recently and has been brought up by the chairwoman. They said, these are the allegations, and I'm sure you're aware of them, but basically it said that there's a shortage of, that masks and gloves are rationed. There's a shortage of staff, and detainees are saying they only have like an hour out of 24 hours that they're out of their cell or room. And as has been said before, 127 of 300 employees tested positive. ICE reported 242 immigrants held in Eloy tested positive since the beginning of the pandemic. So, Mr. Heininger, I just want to give you an opportunity to respond, because I know that media is not always accurate and sometimes they're biased. So if you would like to respond.
Congresswoman, thank you very much. And thank you again for your recent visit to Eloy. We're very proud of that operation, along with all of our operations around the country. So yeah, a little bit to your points there. The Eloy facility does have adequate supplies. Notably, you mentioned masks. So we have, as of last week, 152,000 masks nationwide within our facilities. And so we've got plenty of mask and inventory, but also we have the flexibility. If we have a little bit of a higher usage at one facility, then we can, through our central purchasing program, we can relocate masks to other facilities if there's a higher utilization versus low utilization. So adequate supplies there. You noted also the staff there at Eloy. So we did have almost about half of our staff over the period of time of the pandemic test positive for COVID-19. But that was just in a point in time, not at one point in time where all those staff were positive. So as of last week, we had about less than 100 that were positive, and we're going through the appropriate protocols to self-isolate. But also, to your point about staffing, it was mentioned earlier about occupancy. So again, nationwide, we're about 50% occupancy. And what that does, it gives us flexibility on staffing, because if you're staffed for more like 90, 95%, then you're overstaffed, obviously, based on occupancy. And as you know, Congresswoman, we've got another ICE facility there in Eloy just down the street that has an ICE contract. And so we were able to move staff between facilities if we did have a fair amount of staff at Eloy that, again, were self-isolating because they were found positive through a test. So again, very comfortable with the staffing levels and to be able to kind of change our staffing as appropriate between those facilities if we did have a higher case. And I guess the final point I'd make relative to the cases, as you know, in Arizona, there has been a little bit of an uptick in positive cases within the state itself. And I'd say, reflective to our staff, I think we're pretty consistent with what we're seeing in the general community.
Thank you. I have another question for very quickly. Who is required to wear the masks in your facilities? Is it just employees or is it employees and detainees?
Yes, ma'am. So this is David Heiniger again. So it would be our company policy, and obviously we're following CDC guidance along with ICE detention standards, that all employees are required to wear a mask, and it's recommended to detainees.
For MTC, all employees are required to wear masks, as are detainees.
Same answer for the GEO group.
And the same for LaSalle.
Thank you, Madam Chairman, and I yield back.
Thank you, Ms. Lesko. I now recognize the gentleman from California, Mr. Correa.
Thank you, Madam Chair. Can you hear me? First, I want to thank you, Madam Chair, and our ranking member for holding this most important hearing. And I also want to take a moment to thank our witnesses today for taking time and interest in being with us here on these very important policy issues. I have a question for all four of you. Mr. Markadant, you mentioned that you had rapid decline in population before COVID. Is that correct? And what was the reason for that?
I'm certainly not, you probably all know much more about that than I do, but there is a seasonal difference usually in detention facilities. In the winter, Christmas time, the border crossings tend to go down. There's been
So it's
changes.
just seasonal. But
Some of that, I don't think that's the entire reason. I think there's a number of factors. The asylum hearing changes.
Thank you. Same question for the other witnesses. I only have 5 minutes. My apologies.
Okay.
So,
Go ahead.
Gentlemen.
Similar answer by the GEO group.
Okay.
Yes, sir. Similar answer for CoreCivic too. We did see a change in the winter going into the spring months.
Thank you.
And the same for LaSalle.
Thank you very much. There's been some reports that some of the detainees have been asked to disinfect their own cells and that they've been doing so without disinfectants. First of all, can the four of you answer the question, is that the case? Do the detainees, are they asked to clean their own cells, disinfect their own cells, and are they given proper equipment and disinfectants to do so?
For MTC, all employees and all detainees are part of the hygiene and sanitation process. So everybody has a role to play in that, and cleaning their own areas, and it's a group effort. We have been very careful to have adequate supplies of disinfectant and cleaning materials, and have not had any shortages of that.
Same question for the other witnesses, please.
Yes, sir. It's Damon Heiniger. So yes, we do request that detainees clean up their general housing area, which would be their bunk and their desk and general area of where they reside. And there is adequate cleaning supplies. Those supplies do not require any protective equipment, so they are very well-known cleaners that you would typically see in a setting like this, or healthcare, or other social setting.
So you provide them the proper disinfectants to do so?
Yes, sir.
It would disinfect COVID-19?
Yes, sir.
Same question for the other two witnesses, please.
This is George Zully, the GEO group. Yes, we use ICE-approved disinfectants that are continuously available to staff and to residents to clean all hard surfaces and the housing areas.
And this is Rodney Cooper with LaSalle, and I would tell you that we do the same thing. They are required to clean their own cell or area, but they are given the appropriate equipment and training to do so.
Do you have any kind of supervision to make sure that they're doing some kind of an adequate job of disinfecting their cells? COVID-19 is very infectious, as you know, and our goal, whether it be in the U.S. or in other countries, to make sure we minimize the spread of COVID-19. A lot of your detainees may end up being deported, and we don't want to spread this COVID-19 any more than has to. We want to minimize the spread, I should say. Do you have any supervision to make sure that those detainees are doing an adequate job of disinfecting their own cells? Question for all four of you, please.
Yes, sir. This is Damon Heiniger again. So yeah, we absolutely have staff there in the actual housing areas that are regularly walking not only along the cells, but frequently going inside the cells to check for cleanliness. And that's a practice you do even outside of pandemic like this. And then, like I said, with the cleaning supplies, typically those are either in the unit or actually right outside the unit, but they're in close proximity, so they're always available. And then finally, I would just say that we're doing a lot of town hall meetings in the units, reinforcing the message about hygiene, but also cleanliness within the unit and their housing areas, and continue to kind of reinforce that education.
From the GEA group, and yes, we have maintenance supervisors that assist in supervising detainees in carrying out their housekeeping responsibilities. Additionally, we have monitors in every housing unit that continuously display good housekeeping practices regarding sanitation, washing of hands, and taking healthcare precautions.
Yes, hygiene and sanitation could not be a higher priority for us. It is critical, and it's, again, everybody's job to do that. Every detention officer is trained in their expectations of managing housing units to assure that's happening. Supervisory staff have roles to come in and do audits and inspections, and the facility administrator is on top of that as well. So, I mean, everybody is very focused on it. And it's not an issue that we're fighting people over. They understand how critical this is, and it's a group effort. Everybody's pitching in.
And this Rodney Cooper, I hate to sound like a broken record, but I would agree there. And I would also say that COVID or no COVID, if an inmate doesn't clean their housing area and our staff notice it, then they're going to move them out of that area to a clean area and go back in behind and clean that cell up.
Thank you very much, gentlemen. Madam Chair, I'm out of time, so I yield. Thank you very much.
Thank you, Mr. Correa. I just want to direct a question to Mr. Heininger. Earlier, Mr. Payne referenced a use of force incident at the Torrance Detention Center. You claimed that there have been no use of pepper spray agents or rubber bullets at any of your facilities since the COVID outbreak. In public reporting, however, even Core Civic's spokesperson acknowledged that pepper spray was used. Would you like to address the statement of that spokesperson and amend your earlier statement?
Yes, Chairwoman, I'm very sorry. I understood the question was relative to ICE detainees relative to the COVID-19 and not complying with COVID-19. I apologize. Yes, we did have a use of OC spray there at the Torrance County facility that was referenced earlier.
Thank you, sir. I now recognize the gentleman from Pennsylvania, Mr. Joyce.
Thank you, Madam Chairwoman. I would like to thank all of the witnesses for appearing today, and additionally to thank all members of ICE and CBP for their continued work and service to our nation in this unprecedented time that we have faced since COVID-19. Mr. Marquette, briefly, what I've been hearing that there have been a lot of changing protocols, changing guidelines, as we have learned more about this novel coronavirus. Can you please give us a quick overview of how your company specifically has been able to implement these new protocols and new guidelines?
Well, yeah, they're not anything complicated. I mean, PPE is a good example. At the beginning of this pandemic, there was limited supplies, and the guidance was, PPE should be reserved for those in the medical fields. The Surgeon General in late February said people other than the medical workers should not be using it. So, I mean, we weren't at that point. Then that changed in March pretty quickly. And we had to quickly up this. I mean, we already had supplies on hand, so we were never without it, but we had to make them, we weren't we didn't have supplies for every staff and every detainee to wear it. We quickly mobilized, we increased our orders. A number of our correctional facilities started projects with offenders to make masks. We've made tens of thousands of cloth masks, which are primarily what the employees who are not dealing with COVID positive detainees are wearing. And so we've made tens of thousands of cloth masks and used them for our own use, as well as distributed them in the community through community service projects. Testing procedures have changed dramatically from start to finish. I mean, every component of this, we learn along the way and have changed hygiene recommendations, PPE recommendations, testing recommendations. More is learned, when somebody needs to be transported to the hospital. I mean, every component of this. So we, have, as I said earlier, a medical director on our corporate staff who is monitoring this and helping us give directions to each of our facilities about what changes they need to make on a regular basis.
And I congratulate you on your adaptability. And as more testing has become available, have your protocols specifically changed on which detainees are tested?
Well, I mean, we're really relying on the guidance of CDC and ICE more than coming up with our own protocols. I mean, we may make certain adaptations just in terms of the layout of the facility and how we have to implement a specific recommendation, but we're not coming up with different recommendations than what CDC and ICE are telling us to do. And we work with local, state, and health departments. As I said earlier, the state of New Mexico has been very interested in this topic, and we have worked cooperatively with them and made a number of changes in how we're doing these things, which have been great suggestions and very welcome.
And I think that you following local, state, and CDC recommendations are imperative. I think that's definitely what's necessary. Now, you mentioned about your ingenuity in making face masks. What are the requirements for wearing face masks?
You mean who has to wear them?
Exactly.
Everybody does. All employees who are working in the facility and all detainees have to wear a face mask at all times. Detainees do not have to wear a face mask when they're eating. They do not have to wear a face mask when they're sleeping. But other than that, any movement around the facility, they have to have a face mask on, and our employees do as well. And we are actively enforcing that.
And earlier it was stated that changing behaviors is essential for safety. So really quickly, as my time is expiring, what are the consequences if employees or detainees do not follow your protocols?
Well, we have a progressive discipline process for employees, which we could implement if we needed to. But as I said, this really hasn't been a disciplinary situation. Everybody is very concerned about that. They welcome the information that we're giving them, and they are. It just hasn't been a problem getting people to buy into this. So it hasn't been a problem. We haven't been disciplining many people at all.
Thank you for your concise answers. And Madam Chair, I yield the remainder of my time.
Thank you, Mr. Joyce. I now recognize the gentle lady from the state of New Mexico, Ms. Torres.
Thank you, Madam Chairwoman, and thank you also, Ranking Member. Mr. Marquardt, according to ICE, as of July 10th, in the Otero County Processing Center in the district I serve, there have been 142 positive cases, which makes the facility within the 5th highest number of cases in the country. Briefly, because I have several questions I want to ask, can you please list the top 3 reasons why Otero has seen nearly 150 cases of COVID-19?
Well, Otero the Otero Processing Center currently has 2 positive cases. So, that number is true in the past, but it's not true today. So we've brought down the number significantly. But to answer your question, why?
Just to clarify on that point, it's because you've released detainees, correct?
Well, more of the reason is, they did a mass test in the facility, and the vast majority of the people that tested positive were asymptomatic. And so there was a large number that came on as a result of the testing. That's not the only reason, but it's the biggest reason. And so just through the normal course of the infection, it takes, 2-3 weeks sometimes till a person is symptom-free and would test negative. And we are, at that facility, we have tested everybody, as you know. So we are through the testing and lack of symptoms, just through the normal course of the progression of the disease infection, we're down to 2 right now.
I understand that, and I think I'll actually move on from this question because there are others I want to get to, but I do just want to note that 142 cases, regardless of whether they're symptomatic or not, cause concerns for me, both within the detention facility and also in the community that I serve surrounding it, since you've got staff who are working there, and asymptomatic or not, provides a potential for, as we've seen, an increase in the spread of COVID-19. I just want to move on quickly to your contract with Otero County and ICE. I really appreciate the questions from Ranking Member Rogers surrounding the capacity and ability to social distance to reduce the spread of COVID-19, and I wanted to follow up on that conversation. Mr. Marquardt, on March 31st of this year, MTC sent a letter to Otero County issuing a notice of termination with respect to the Otero County Processing Center. MTC cited the reason of termination to, and I quote, the significant decrease in the detainee population, end quote. MTC also noted it had hoped ICE would keep the facility full and remain hopeful that the detainee population will increase. That's a quote. So it's my understanding that MTC is currently negotiating a contract modification to continue operating the facility. So based on that letter, it seems like MTC's profits depend on a high detainee population. Is that correct?
The issues at the Otero Processing Center were that the facility was designed for almost 1,100 detainees, and we staff get inventory at that levels. The actual number of detainees in the facility dropped to around 300. So
is it true that the profits depend on the high detainee population?
Well, it's the terms of the contract, I guess, would, but
Okay.
Our greatest priority is the safety and health of the detainees. It has nothing to do with profits, and we would never make a decision on profits and not the safety and health. The county.
I appreciate that, Mr. McCourt. And just because my time is short, I want to make sure and get to continue. So I appreciate you answering my question that your contract is determined based on the number of detainees that are in the facility. And I also appreciate your concern and your statement that you would never then seek to have a higher population if it would put the risk of detainees or staff operating the facility at risk, or the health of them at risk. So during a pandemic, would you agree that increasing detainee populations to pre-pandemic levels would compromise the health of detainees and the staff who work in detention facilities?
I think we can gear up at a variety of different levels to keep everybody safe. But I would not at all deny that the current low levels have been coincidentally or purposely have been helpful in managing the pandemic, because we have a lot of room for social distancing and keeping people safely apart. So I think that what's happened is not a bad thing at all.
And would you agree that increasing the population to pre-pandemic levels could compromise detainee and staff health?
Well, I mean, I think it's a more complicated question than a yes or no. I mean, there are a number of factors in that. We could come up with different procedures to maintain distancing at higher levels. So I don't think just automatically because they're higher levels, it makes the facility unsafe. But we have to think through every one of those elements of making the facility safe, and at whatever level, make sure that we can ensure that happens.
My time has expired. Thank you.
Thank you.
Thank you, Ms. Torres Small. I now recognize the gentleman from Mississippi, Mr. Guest.
Thank you, Madam Chairman. Gentlemen, I appreciate each of you for appearing before the committee today. You perform a very important service for our country at a very difficult time with the outbreak of COVID-19. And while I'm not able to speak about every facility that each of you operate, I am able to speak about one. CoreCivic operates an ICE detainment facility in my district in the state of Mississippi. And Mr. Hanniger, I want you to know that the administration at that facility has been in regular contact with myself and my staff throughout the COVID-19 outbreak. I can tell you that from those conversations, I believe that you have taken very aggressive steps to protect the safety of the detainees and the employees that work there at that facility. So, Mr. Hanniger, I want to ask you, as it relates to CoreCivic, when did your organization begin to monitor the pandemic?
Congressman, thank you for your question. So it was really in early February as we were monitoring the outside environment, not only internationally, but nationally, and also direction we're getting from CDC. It was during that period of time that we started taking proactive steps to check on things, not only on protective equipment, but supply chain, and maybe additional things that we need to tweak relative to our operations to make sure we are prepared what ultimately became the pandemic that we live in today. And then it was a little later in the kind of winter, spring months that we activated our Emergency Operations Center I mentioned earlier. And this center is consistent with kind of the protocols that you see at FEMA and also uses similar software. We activated that in early March, and it serves as a kind of a clearinghouse to digest information from CDC and ICE that we can quickly push out our facilities from a policy and process perspective, but also allow for real-time adjustments because as everybody here on the committee knows, adjustments have been made and guidance has also changed during a period of time. So we want to make sure that we can quickly get that information out. And then finally, we also started in early March a COVID-19 task force, had a leader of the task force that has experience in these type of events, and also our chief medical officer, along with other operational leaders. And then they're again also kind of providing real-time kind of guidance, advice, and medical direction to all of our leadership within our facilities.
And as you've seen guidelines change from CDC, from ICE, from some of your local and state health departments, have you had to be flexible and make changes to the things that you are doing at your different facilities?
Yes, sir, absolutely. So, CDC and ICE, again, have been kind of the lead on providing us guidance and direction and feedback on our policies and processes. But also we're watching closely on what governors and their public health authorities and also city and county leaders are doing too. And it has been a little bit of a customized approach based on certain jurisdictions, not only just on, steps and protocols and requirements, but also what's going on in the community. If we see an event in the community or in the state where you have a higher number of positive cases, obviously we know that has an impact on us. And it also maybe have a little different or changing requirements or guidelines from state or local officials.
And Ms. Heiniger, there was some conversation early on about when inmates are transferred to a facility about the processing of new detainees or detainees that are transferred to one of your facilities. Can you speak on that just a little bit and expand on that, if you will?
Yes, sir. So we have a process that has been endorsed and somewhat directed by ICE that we do a protocol for every group of individuals that are leaving our facilities. And so we go through this checklist. Again, it's a document that's been endorsed by ICE. Additionally, we get a medical check done. They get a medical check done by them, by our medical staff, depending on where they're being transferred to. And also, many of them, again, depending on the medical authority, may get an actual test before they depart the facility. So many different steps. At the end of the day, we're following the direction of ICE on the appropriate steps we need to take before a transfer takes place.
And when individuals are transferred into your facility and they're showing symptoms of COVID-19, what would happen to that detainee at that point?
Yeah, so we would, again, when say a transportation vehicle or a bus comes into Sallyport, we have staff along with medical staff going on the bus immediately, doing quick symptom and temperature checks. They're coming in institution. If they are showing signs of COVID-19, then they would be isolated. But regardless, I should say, anybody come institution from outside is going to be isolated and quarantined for 14 days before they go into the general population.
Thank you, Madam Chairman. I yield back.
Thank you, Mr. Guest. I now recognize the gentle lady from New York, Ms. Clark.
Thank you very much, Madam Chair. And let me thank our ranking member, Mr. Higgins. Let me thank our panelists for appearing before us today. We know that more than 3,000 immigrants in ICE custody have tested positive for the coronavirus. Given the lack of testing in ICE facilities, we all know that true number is much, much higher. We also know that much more could be done to protect immigrants in custody from COVID-19, but unfortunately, this administration, and I also believe your companies, have failed to put safety first. Today is about accountability. Many ICE detention facilities are run by private companies such as yours. When you're in the business of detaining immigrants and implementing the policies of this administration, you don't get to just answer to your stakeholders. You must also answer to us. You must answer to the families of immigrants in your custody who right now are worrying not only about the immigrants in your custody. Right now, they're also wondering whether they will ever see their loved ones again once ICE deports them, but also about whether they will each catch the coronavirus in one of the crowded cells that tend to be the case with your business models. So let me ask, here are a few facts. Not enough is being done to stop the spread of in your facilities. 286 detainees at Blue Bonnet Detention Facility tested positive. 250 detainees at Eloy Federal Contract Facility. 202 detainees at Montgomery Processing Center. 126 detainees at the Wynn Correctional Center. People detained at Eloy, operated by Core Civic, also report numerous instances in which people who may have been exposed to COVID-19 are grouped together, a dangerous practice known as cohorting, which is directly linked to the spread of COVID-19 in detention. So my question is for all of you gentlemen, why do you think your facilities were unable to control the spread of the virus in your facilities? Was it the surprise element? Was it a lack of resource? What was it that failed to recognize that in congregate care such as yours, the spread would infect rather rapidly? We want to start, Mr. Cooper?
Yes, ma'am. I'd be happy to. Thank you. You mentioned our being responsible to you, but I feel like we're also responsible to the good Lord. And so that's the one I care about the most of how we treat detainees and how we treat anyone. And so the safety of everyone is our concern. As far as, stopping COVID, I'm pretty comfortable that if
I'm pretty sure I said to control it.
Ma'am?
I said, I'm pretty sure that my question was, what do you do to control it? Not stop it, but control it.
Well, to control it, of course, we follow the CDC guidelines, the guidelines handed down by ICE and from public health authorities. And I think it's been very successful when we look at the numbers that we had initially and we look at the numbers we have now. And of course, when you do mass testing, you're going to get some higher numbers. However, I think our staff has done very well to try to control it as best we can. And, the fact that, as I mentioned in my opening statement, that we have not had any detainees succumb to COVID-19, I think that speaks for itself.
Mr. Heiniger.
Yes, ma'am. So we have a 24/7 operation. So we are always thinking about the unexpected. So if it's a natural disaster, if it's a pandemic like this one, if it's communicable diseases, we're always thinking about how do we prepare for the unexpected. And so I talked a little bit earlier about not only the investments we made in the EOC and also the COVID-19 task force, but we really also have really leaned on CDC and their guidance on what we should be doing, both proactively, but also during this pandemic, along with obviously direction that we're getting for ICE. And so have we been perfect? Absolutely not. But I feel very confident in saying that we have made big investments in not only protective equipment, but also making sure that we have the appropriate staff, that they feel comfortable and safe when they come into our institutions. And as I mentioned in my prepared remarks, we've also rewarded them with a bonus that we called a hero bonus, and also give them extra time off. And then also told them if they feel sick, don't come into work. Self-quarantine for 14 days. And so, again, have not been perfect, but I feel good that we've made the appropriate investments along the way.
Mr. Zoli.
We've also invested heavily in the protective equipment that we've distributed to all of our employees, all of our detainees, but we place also an importance on testing. We've tested almost 5,000 detainees to date, and we believe saturation testing, that means testing everybody, is the best thing you can do. And that's why we're excited about getting 45 of the Abbott machines, which are the most effective tests, because people talk about tests.
And when do you believe that will be in full effect?
We're hoping in September when we get the machines.
Very well. Mr. Marquardt. Mr. Marquardt?
I think there's no greater priority for us than the health and safety of the detainees and the staff that work there. So we're going to do everything that we possibly can. There isn't a perfect solution. Until there's a vaccine and a cure for this unfortunate infection, we're going to have the same problems that the community has. The big advantage that we have is the ability to isolate and control movement that schools and everywhere else in the community does not have, and that gives us a big advantage in controlling the spread. They're really the biggest thing we can do. I think testing is an important management tool, but it's not the panacea, as I said in my opening statement. The thing that's going to make a difference is controlling behavior, and there's 3 specific things that we can do.
I apologize. I'm over time, and I appreciate your responses, gentlemen. Look forward to following up with you. Madam Chair, I yield back.
Thank you, Ms. Clark. I now recognize the gentle lady from California, Ms. Barragan.
Thank you, Madam Chairwoman. Mr. Zoli, this question is for you and Mr. Hinzinger.
I'm sorry, Ms. Barragan. I overlooked the gentle lady from Texas, Ms. Jackson Lee. I apologize.
I thank the chairwoman and ranking member for yielding and for this hearing, along with the full committee chair and ranking member. Gentlemen, you're being asked questions over and over again. Please understand that it is our crucial responsibility to engage in oversight. With that in mind, I think it is appropriate, because I'm in one of the hot spots and your facilities are located in a hot spot among others, and that is the state of Texas. We now have 265,000 cases and 3,252 people have died. For this meeting and many others that I'm dealing with, as well as a major testing, is life and death. And I would disagree with the gentleman who indicated that testing, he might want to correct his statement, is not important. It is one of the most important elements of stopping the community spread, particularly as it relates to the idea of asymptomatic persons. So let me ask each person, realizing the shortness of my time, I just need very quick answers. Mr. Haniger, what is social distancing to you? How do you space out the detainees? Very quickly, please.
Yes, ma'am. Thank you for your question. So quite simply, it is, the guidance, which is, 6 foot or further apart from each other, but also as it relates to our institutions, making sure that there's appropriate distance in certain service areas, like in food service, medical, or other areas where there would be common usage between detainees.
Thank you. Mr. Zoli, what is it for you?
A very similar answer. That is, we've benefited from having a capacity that's less than 50%. You can put people at greater distances from each other, whether they're in dormitory housing or room-style housing.
How are you dealing with the new information? Forgive me, my time is short.
turn.
that COVID-19 is airborne, and that has been recent information. How are you dealing with that? How secure are you using N95 masks?
No, we're using the surgical mask for the detainees, which are replaced 2 or 3 times a week or as necessary or at their request. Staff are in a different kind of.
I think the masks need to be certainly more solid than that. Mr. Marquette, are you retesting, and what do you do with asymptomatic persons? Do you retest? One test may show you are negative and you may be positive within a week or so if you've been exposed. That includes employees as well as detainees.
Let me just clarify that I did not say testing is not important. I said it's not a panacea, but testing and changed behaviors are the best tools that we have to control this pandemic. So
please highlight it as one of the most important elements, because that's the only way that you can get information.
I totally agree with you.
Are you retesting? What are you doing about asymptomatic persons?
Well, asymptomatics are probably the most difficult part of this equation, because someone can be asymptomatic and we don't catch them through our screening procedures. Once a person takes a test, gets the virus, it takes an average of 2 days up to a maximum of 5 days before they would test positive in a test. So even if we're testing every person that comes in.
But are you retesting? That's my question. Are you retesting?
It depends on the facility. We have a facility in New Mexico that we have tested and retested every person in the facility. So at other facilities, there's less availability of testing, and that is not happening.
Thank you. Mr. Cooper, do you have medical teams on site of your facilities?
Yes, ma'am. We do have medical teams on site.
Does that include a doctor?
Do have doctors that at some locations, doctors are there every day. Some locations, doctors come by 2 to 3 times a week.
Mr. Zoli, again, let me ask you to look into your Liddell Center on Commerce Street in Houston, Texas, where it's been reported to me that there are several deaths in that facility, and I'd like to make sure that you get back to me directly on that. And so let me move on. With respect to the White House task force, did you hear me, Mr. Zoli, about the Liddell Center?
Yes, I did.
All right, so that I will ask for you to get back to me directly. But as it relates to the White House task force, have they been engaging with each of you about particular ways you can handle detention centers and your facilities? I'll start, Mr. Cooper. Have you been engaged with the White House task force?
Ma'am, I've not personally been engaged with the White House task force, but I do see the guidance that comes out through the CDC.
You follow that? You follow that?
Yes, we do follow CDC guidelines.
Mr. Cooper, do you follow that?
Yes, ma'am. Can you hear me?
Yes. Do you follow that?
I said we do follow the CDC guidelines and DHS recommendations.
Thank you, Mr. Marquette. Do you follow that?
Absolutely. We have been very rigorous in following CDC, ICE, and state and local health guidelines.
Mr. Haniger?
Yes, ma'am. Similar answer. CDC, ICE, and city, county, and state guidance.
Mr. Zoli, thank you very much.
Yes, ma'am. Same answer.
Thank you very much. That includes Dr. Anthony Fauci, who I have great confidence in and hope that he will continue his work in spite of being demonized by unfortunate conversations. I think it's important that we take note of the fact that Dr. Fauci has been an instrumental part of the White House task force. With that, Madam Chair, I'm happy to yield back and thank all the witnesses for their presentation. There'll be a number of issues that I'd like to follow up on, more extensive understanding of medical teams there, as well as the retesting and what they're doing with asymptomatic persons. I think that is crucial with the close proximities of these detainees in order to save lives. Thank you, and I yield back.
Thank you, Ms. Jackson-Lee. I now recognize the gentlelady from California, Ms. Barragan.
Thank you, Madam Chairwoman. Dr. Zoli and Mr. Hinzinger, I serve as the second vice chair of the Congressional Hispanic Caucus. On Friday, June the 10th, our chairman, Congressman Joaquin Castro, sent a letter to the both of you. The letter deals with concerns that CHC has regarding the treatment of individuals in ICE and ICE contracted facilities in regards to the coronavirus pandemic. and the ability of facilities to contain the spread of the virus. The letter requests that you both brief the Hispanic Caucus on the questions and concerns that we have. Will you both commit to doing that, and if so, when? Dr. Zoli?
I think I would. I've been honestly quite busy preparing for this meeting, so it would be in sometime this month.
Thank you, sir. And Mr. Hinsinger?
Ma'am, I am aware of the letter received, I think, late Friday afternoon, and we will follow up with staff as appropriate. And I know that we have several facilities within member districts on that committee, or not caucus, I should say, and always available for tours or opportunities to see the operations firsthand.
Okay, I noticed you didn't make a complete commitment, but I hope you will meet with the Hispanic Caucus. We have a huge constituency, and as you said, many of our members you have facilities in. Dr. Zoli, federal judges have found that at least two of your facilities, Adelanto in California and the Broward Transitional Center in Florida, or BTC, were creating unreasonable risks to detainees. In the case of Adelanto, the judge found that the facility had created a massive risk of COVID-19 infection. The DHS Office of Civil Rights and Civil Liberties, in inspecting Adelanto, also recently found failures in leadership, quote, contributed to the inadequate detainee medical care that resulted in medical injuries. In the case of BTC, among other facilities in Florida, a judge recently found that the conditions rose to deliberate indifference and recently raised concerns about a continued failure to provide detainees with bare minimum necessities, tantamount to the infliction of cruel and unusual punishment. Again, these are the words straight from the court and the judge. How can we take your assurances today seriously when your facilities repeatedly failed to live up to the basic standards?
We think our facilities are not only meeting the standards, but exceeding them. And, we have on-site medical staff as well as on-site ICE presence that helps oversee whether we're meeting the contractual requirements. And ICE has a very sophisticated health services unit that also oversees all the health services at all ICE facilities. I think it's really part to any healthcare correctional organization in the world.
Okay. Well, Dr. Zoli, I just remind you that these are words from a court and from a judge. In addition, findings from the Office of Civil Rights and Civil Liberties, which I concurred with, made these findings. So if you really don't see how that's a concern and that you don't believe it's happening, I think that maybe there needs to be a sit down and a look into how there's such a huge difference between what these office is saying and what the judge is saying, which differs from what we're hearing from you today. For the GEO group, in April, a group of women held at the LaSalle ICE Processing Center came forward alleging that they went several days without access to soap or other cleaning supplies that would protect them from the virus. Since these concerns were raised, at least 15 migrants held at the facility have tested positive for the virus. Has GEO independently investigated these reports and determined if negligent actions have fueled the spread of the COVID-19 in the detention center and local communities?
I'm honestly not familiar with that situation, and I would find it surprising because we've had sanitation and hygiene products available continuously. I would like to get back to you as I investigate that.
That would be great. I really would appreciate that. Can you help shed some light on what steps you've taken to respond when a detainee has concerns like this, that they don't have access to proper hygiene products? And what's your policy with providing personal protective equipment to detainees? I know employees probably get them, but what about detainees?
Well, our policy is to make it continuously available. What does that mean? It means that they get it by schedule 2 or 3 times a week, and they get it if they ask for it, that they've run out of it and they need some more, it should be available at all times. That's my desire, and I think that's our policy.
Okay, and the first part of that question, if you can't respond today, getting back on what steps you take when a detainee raises concerns about not having access to proper hygiene, that would be really helpful.
Okay, well, I've never received such a request personally myself. So,
Well, does your staff raise it to your level? I understand that
yes.
a detainee wouldn't have access to you directly.
Well, they
just
do.
As,
They do. They send me
when one of my
letters.
constituents calls me, it goes up the chain, and I hear about it when there's a concern. So do you not hear about these?
I get letters all the time, and I refer them to the appropriate division within our company.
Okay, Madam Chairwoman, I yield back.
Thank you, Ms. Barragan. I now recognize the gentleman from Colorado, Mr. Neguse.
Thank you so much, Subcommittee Chairwoman Rice, for allowing me to participate in today's hearing. Prior to COVID-19, the GEO-run detention center in Colorado was known for complaints regarding a variety of civil rights and medical violations. And these complaints are not unique to Colorado, as my colleague, Representative Barragan, just referenced. And unfortunately, poor conditions that already existed have only been exacerbated by the failure of ICE and private contractors to adequately respond to COVID-19. As governments around the world implemented lockdowns and other measures to slow the spread, the Trump administration took a different approach of continuously transferring detainees between facilities multiple times a week and sometimes daily. In recent weeks, my office has heard reports of dozens, potentially hundreds of detainees being moved in and out of the Colorado facility with little to no notice to the individual being transferred or their family or their lawyer. So Dr. Zolli, yes or no, will you commit today to providing at least 24 hours notice in advance to the families of a detainee and their lawyer upon notice of a transfer out of the Colorado facility?
I don't know if I have that ability.
Well, I guess what I would say, Dr. Zolli, is to the extent you have the ability, if ICE is informing you with enough time for you to provide that notice, will you do so?
I would have to look into our ICE procedures and whether I'm allowed to do something of that nature.
Well, I guess what I would say, Dr. Zolli, is the notion that that you would be unable and your facilities would be unable to provide a modicum level of notice to individuals who are being transferred in the dead of night to at least tell their families before that's done, to me, is a bare minimum requirement, and it's disappointing that you're unable to commit to that today.
Could I commit?
Another question I guess that I'll pose to you. We've also heard reports that some of these transfers could be in retaliation for speaking out against inhumane treatment or a lack of PPE, soap, safe hygiene products. Dr. Zolli, do you have any knowledge of any ICE transfers being implemented into and out of your facilities, such as the Colorado facility, for any retaliatory reasons?
No, I do not.
Are you aware of a transfer of 100 or more detainees recently being transferred out of the Colorado facility to places such as the Teller County Jail?
No, I'm not.
Okay. Well, if you'd be willing, I certainly would appreciate if you could direct your team at the Colorado facility to respond to our inquiries in that regard, as we've tried to obtain more information about these transfers. I want to ask you about the use of a powerful chemical disinfectant referred to as HDQ Neutral and Halt inside some of the immigration detention facilities. Our understanding is it is causing bloody noses, rashes, nausea, difficulty breathing. The manufacturer has very strict warnings about their use, only outdoors or in a well-ventilated area, and yet there have been reports of their use in crowded and confined spaces at the Adelanto facility, Northwest Detention Facility, and in Aurora, which are all GEO owned, including using those and being sprayed while detainees are still in the room. Can you commit today that GEO will immediately stop using those dangerous chemicals to the extent they're used not in line with manufacturer's instructions?
No, I cannot. We've been using that cleaning product, which is registered with the Environmental Protection Agency and follows strict safety guidelines set by FDA. The HDQ neutral cleaning product has been used at the Adelanto facilities as well as other facilities for 9 years.
The question, Dr.
Never reported any adverse effects by anybody. There's no
question, Dr. Zolli, the question, I'll reclaim my time. The question is not as to whether or not you will stop using the chemical, but making sure that it's being used in line with the manufacturer's instructions. That is all. To the extent
Absolutely. I misunderstood your question.
The last question I have for you is regarding performance-based national detention standards. As you know, the ICE performance-based standards say that detainees shall be shall be able to volunteer for work, but otherwise shall not be required to work. Has GO ever used the threat of solitary confinement or segregation or other sanction to force individuals to clean and sanitize common areas?
Detainees are required by ICE to keep their own personal areas clean. And that's a requirement by ICE.
And I'm not asking about their personal areas, Dr. Zoli. I'm asking about common areas. But how about this? I'll rephrase it. Has GO ever coerced immigration detainees into volunteering to perform work by threatening or imposing disciplinary segregation, administrative segregation, or solitary confinement, or any other kind of sanction?
Absolutely not.
Okay, well, as I'm sure you're aware, there are multiple lawsuits pending against GO where allegations have been made precisely on that basis. And my understanding from a letter that was made public last year, your senior vice president for business development asserted that to the extent the plaintiffs in those lawsuits were alleging that disciplinary segregation was an unlawful threat for refusal to work, that sanction came directly from ICE policies. And yet we can find nowhere in an ICE policy where such conduct would be permitted. So I would ask that you follow up with our office in writing with respect to that particular reference to ICE policy.
Okay, I will.
With that, I yield back, Madam Chair. And again, thank you for allowing me to participate.
Thank you, Mr. Neguse. I have a question just to all four of our witnesses. Will you each commit today to adding a page on your website to report daily the number of COVID positive employees at each of your facilities used for immigration detention operations? This is something that ICE does, and I'm assuming that if ICE can do it, all of you should be able to do it. So I'd like to get an answer from each of you, just yes or no. Would you commit to adding a page to your website with that information?
Madam Chair, this is Damon Heiniger. We would absolutely follow up with ICE, and if it's in accordance with them and appropriate, then we would absolutely do that.
Well, if they do it, there shouldn't be any objection that they have to you doing it.
Yeah, we're a contractor, so we just need to make sure we're following the appropriate terms and conditions of our contract, but we will absolutely follow up with them.
Okay, Mr. Zoli?
Similar response.
Mr. Marquardt?
We're open to doing that, assuming, again, it's okay with ICE and doesn't violate any HIPAA standards of the people involved. But yes, we would be open.
The number, not the names. It's just the number of employees, not the names. And also, finally, Mr. Cooper?
As the others have said, we would be happy to get with our government partner and discuss that.
Okay, thank you. Mr. Higgins, do you have a final question you'd like to ask?
I do, Madam Chair. Regarding contact tracing, that Mr. Marquardt, I took a note during your opening statement that you had advised that your detainees were questioned in some manner to determine if they've been in contact with any other human being that is known to have COVID-19. How are you possibly accomplishing that? It's difficult enough in a cooperative and free environment, and here you're dealing with children of God that have been detained for one reason or another by the decision of ICE, but they're just knowing who they're communicating with, who their families are, who they've been in contact with, including from other nations. Yeah, how are you conducting contact tracing with your detainees successfully? You seem to indicate you're doing so successfully.
I think my comment earlier was in regard to screening detainees coming into the facility and asking them if they have been traveling to any high impact areas like China or other places. That was it in the beginning, and other places have been added since then.
Okay,
in terms of actual contact tracing, we would only be doing that within the facility if somebody's tested positive in our facility.
Understood. Yeah, I heard your answer incorrectly earlier. And Madam Chairwoman, I thank you very much for convening this hearing. And despite the technological challenges, it was wonderful to see you all, and I look forward to a restored regular order where we can commune in person, and I yield.
Thank you, Mr. Higgins. I also just want to see if we are in a position to do another hearing like this. It's my understanding that the Republican side did not ask to have a witness at today's hearing, and I wish I had known that, because I would have suggested that you get someone from ICE. Maybe they would have had a more affirmative answer to you than they would have, maybe they wouldn't have quoted OMB guidance. You can
I have
line about that.
Does the gentlelady yield?
Yes.
Let me say that I've had some indirect contact with ICE about their participation in a hearing like this, and they are following guidelines. However, they're receptive to meeting and to attending a hearing like this in the future, but their guidelines call for at least the chair of the majority to be present with they have to appear in person. So that's my understanding, and I'm prepared to stand corrected, and hopefully we can work together as we always have and make that happen.
Absolutely, Mr. Higgins. I would be more than happy to sit with you in the committee room if that will get ICE.
Yes, ma'am. You have my word, good lady, that I will work with the minority staff and my friends at ICE and my contacts there, and we'll circle back with your office and through the chairman, of course.
Thank you so much, Mr. Higgins. To all of the witnesses today, I want to thank you so much for your patience, for your presence and your patience. These are very extraordinary times, and I apologize for the technical glitch that we had, and I'm very cognizant of your time. We went a little over, and I'm just very grateful for your patience with this process. I ask unanimous consent to enter into the record statements from the Detention Watch Network about ICE's detention policies and operations and National Immigrant Justice Center about another ICE contractor, Immigration Centers of America, whose facility in Farmville, Virginia, have further raised serious concerns about its management practices in light of the ongoing pandemic. And in addition, statements from family members of those who have died while in custody. The members of the subcommittee may have additional questions for the witnesses, and we ask that you respond expeditiously in writing to those questions. Without objection, the committee record shall be kept open for 10 days. Hearing no further business, the subcommittee stands adjourned.